Okay, looking at IEC on discharge, or the advice that you can give upon what? Discharge. So, during postnatal period or upon discharge, the mother should be taught on the following: sleep and rest. The mother is supposed to be advised to take enough rest at home so that her body can recover from the stress of pregnancy and indeed labor. Stress may affect lactation and breastfeeding patterns. If the woman feels able to participate in light activities of daily living, she can do so as long as she rests adequately. The mother should be encouraged to rest when the baby rests, as the baby's wakefulness is unpredictable. Another aspect, the mother is supposed to be given advice on nutrition. So, the mother is advised on the need to take a mixed diet to promote lactation and healing. Mothers should keep their fluid and calorie intake fairly high to ensure optimum and quality as well as quantity of what? Breast milk. Advice should also be given on hygiene. The mother is advised to maintain high standard of hygiene to prevent infections. The mother is given advice on children's clinic. The mother is advised on the importance of under 5 clinic to take the baby for growth monitoring and immunizations as prescribed. Advice on family planning. The mother is advised to start family planning and when to resume sexual intercourse, preferably after 6 weeks. Advice on exercises. The importance of exercises such as promoting blood circulation, lactation, restoration of tone of muscles, maintenance of posture, and a general well-being is what discussed. To resume most normal activities after 6 to 8 weeks. This includes going back to work if the woman wishes to, gentle exercise, shopping, swimming, sexual relations, etc. However, it depends on how she feels physically and what psychologically. Exercises are part of the important aspect that are supposed to be taken into consideration. Being as mobile as possible after delivery and gently exercising the legs and feet can help to prevent clots or thrombosis from developing in the calves. Pelvic floor exercises should be started in the antenatal period. The pelvic floor muscles become stretched during delivery, resulting in weakness of the bladder or bowels. A degree of prolapse of the vagina or sometimes can cause what? Painful intercourse. Tightening this muscle regularly, which is the same action that is required to stop the flow of urine and midstream, can help strengthen the muscle and return its turn toward normal. Then, an emphasis on the sexual activities. So from a physical point of view, a woman can resume sexual relations very soon after childbirth, although it is not advisable to wait until all bleeding has stopped, around 3 to 4 weeks, since infection is more likely to occur following intercourse, whilst the womb is still recovering from giving birth. However, many psychological as well as practical effects may result from the birth of the baby, and these could have an effect on both the mother and the father and change the sexual relations between the two. On a very practical example or level, both parents are likely to be tired looking after the demands of a newborn, leaving little energy for sexual activities. The tiredness may affect one partner, more than another, leading to the possibility of misinterpretation by the other partner that they are no longer loved as much as before the baby arrived. Some fathers in particular feel usurped by the new arrival who commands so much attention of the mother, and this again may lead to misunderstanding and friction. So, advice again on danger signs and preparedness. Danger signs for both the mother and the baby are discussed, and prompt seeking of care is advised. This is a song that we've been singing all along during our discussion. Danger signs. Breastfeeding, where she's also advised on the importance of exclusive breastfeeding. Baby care, emphasis being made on how to clean the cord, general hygiene, infection prevention, and warmth. Birth registration, the parents are reminded that it is their responsibility to register their baby with the local registration office. Postnatal review, she is also advised to go to the clinic for the postnatal review after 6 days and then after 6 weeks. This is the information, education that you are supposed to give to this woman upon discharge or during postnatal care.